Over the 6 years of doing the show, we are now at, last time I checked, over 110 episodes in our show's vault. So excited to be off and running with Season 7 of The Big Bit Theory. I'm Bill Culhane with Rick Jennings standing by at our studios here in Austin, Texas. Starting with this episode, we fully intend on having another season of interesting topics that are important to you. We're going to reach out and bring on to the show the best, the very best, in terms of expert guest. Starting with Dr. Rodney Rohde, Dr. Rohde's forever considered our resident expert on everything involved in public health. More on Dr. Rohde and our upcoming visit in a moment. First, I do want to welcome back the gentleman known as the maestro of the show, Rick Jennings. Rick makes all the magic happen behind the glass, and certainly not to be forgotten, he's the conductor of Crazy Bids as well. Our longtime listeners, of course, know that Rick, on each and every episode, Rick will go out and research and find a bid that oftentimes is humorous. All the time, I consider Crazy Bids being really interesting. I trust that you'll feel the same if you're a first-time listener. Rick, I see you over there. You appear to be refreshed at our production meeting earlier this week. You were chipper. Share with our audience, what were you up to during the show's break?
Well, Bill, I could tell you that I did fun things like taking road trips and doing my taxes and such, but I bet what you want to hear is that I bought myself a brand new computer rig that's super powerful, and I am so glad to be able to use it to hop right back into editing Season 7 of The Big Bid Theory. So I'm very excited to do that and very excited to be here with the team again.
Sounds good, Rick. Again, glad to have you back, of course. And Rick, a Texas State grad, with Dr. Rohde coming by in a moment to discuss, among other things, PPE, personal protective equipment. As part of your research in your day-to-day travels, your day job, I know you've kept an eye on the growth in government purchasing activity related to PPE. When it comes to PPE, what have you seen?
Well, I mean, it's pretty easy to see. I mean, PPE has blown up all over each industry that government agencies are involved in. I mean, they still need to keep operating just the way they have. And with that, of course, they all need protective equipment, gear, supplies, and lots of things like that. So tons and tons of agencies, probably close to all agencies, are asking for this. So it is a very, very big industry right now.
All right, Rick, great information and a great lead-in to our conversation here in a moment with Dr. Rohde. Before you start pushing the buttons over there, Rick, before you get back to it again, we always have a great crazy bid, no pressure, a great crazy bid to start the seasons. Share a tease for the audience.
Oh, gladly. You will like this crazy bid if you're a fan of, let's say, Alaska and classic programming from the Discovery Channel. I'm very excited to show you guys.
I speak on behalf of everybody. Can't wait for that. Similar to our audience, I'm beyond excited for the inaugural version of Crazy Bits here in Season 7. I say Season 7. Every time I say that number, it amazes me. Since our visit way back in March of 2020, our friend and guest, Dr. Rodney Rohde from down the road, down I-35 there at Texas State University, he has been incredibly busy guesting on an insane number of shows, podcasts. He has shared written materials, reports, studies, so much more. I guess it was late last week he presented an invited talk on rabies to the Tri-State ASCLS meeting, and that covers Georgia, Alabama, and South Carolina. Dr. Rohde has 7 presentations over the next few weeks, so we are very appreciative. He's carved a little bit of time out for us here on the Big Bit Theory. And incidentally, links to his bio and paths to some of that info are included. As many of you know, Dr. Rohde is the chair and a professor for Texas State's Clinical Laboratory Science program. Dr. Rohde has earned a myriad of certifications across the lab spectrum. He was recently named a 2021 University Distinguished Professor. As but one example of his relentless work, just this week, Dr. Rohde's piece, Virus Spillover and Emerging Pathogens Pick Up Speed, was published in Contagion Live, actually the cover story. You can find the link, visit Contagion Live online. We'll talk more about that report here shortly. But before we have our visit with Dr. Rohde, here's a brief message.
The Big Bid Theory is brought to you in part by Bid Prime. Over 11 years in changing the bid services industry, Bid Prime has become the solution for businesses serious about winning public sector business. From the premier technology in the industry to real-time bid notifications, supporting documents, and robust data tools, it's all backed by unmatched personalized customer support. Bid Prime. Start your free zero-obligation trial today. bidprime.com.
All right, very good. And now, with no further ado, gave his introduction here a moment ago, let's bring on Dr. Rohde.
Dr. Rohde, we've established that you and I last spoke, it was about a year ago, March of 2020, basically at the infancy, the beginning of COVID-19. And before we get started really into the meat of our conversation, I do want to recognize and applaud you for the work and effort you've put into this fight. The tireless focus you've had on educating people, not just here, but around the globe. Kudos to you.
Thanks so much, Bill. It is hard to believe it's been a little over a year since we had that conversation, and it's been a passion of love as well as frustrating year, but also one of the most productive and kind of interesting years of my career. So I'm excited to be back with you, and let's talk shop.
Here we go. So first of all, and it's for the folks who are listening, I do want to date stamp our conversation, understanding that a lot of information can change over the days, weeks, months, years. But today is Tuesday, April 13th, 2021. Years ago, Dr. Rohde, I guess it was when you visited with us for the first time back towards the end of 2016, you and I were discussing Zika. And on this very show, you proclaimed viruses are going to virus. I remember it like it was yesterday. Are we now saying that viruses are going to evolve? And I guess as a segue, what is meant by virus evolution and a somewhat ominous sounding spillover intersections? What do the folks listening to the show need to know about those terms?
Yeah, thanks, Bill. That's a nice way to start. In reality, and I do remember saying viruses are going to virus, and I continue to kind of use that phrase. And in reality, they always are evolving and mutating. And so I want the audience to kind of understand that this is not an abnormal thing, that viruses continually mutate, they continually change, and they go through processes. One of the ways an analogy I like to talk to the public about this is that if you've ever played that old game telephone, and you tell a friend a story kind of in their ear, and then they tell another friend, and by the end of the line, you get a completely different story. And that's kind of what viruses do over their generations, but they do it rapidly. They constantly amplify and mutate, and they basically are changing their genetic code really in relationship to the pressures around them. So vaccines and therapies, and maybe they want to survive longer than just a short time. So they're constantly doing this, and many times it doesn't matter. They'll actually die because of these mutations, but other times they create new variants, if you will, new cousins, and those might be more adaptable to the human situation. We can talk a little bit more about that as we move forward, but it's certainly not something that is meant to scare people. It's more about just the recognition and the realization that viruses are constantly changing, and really microbes constantly change. It's just that viruses do it so rapidly because they replicate so often, so their rate's a little quicker. And then you have that interface, as you mentioned, between wildlife and humans, and sometimes that happens to jump into a human from an animal per se, and you've got a problem. And that's kind of what we've been experiencing with coronavirus the past year or so now.
We're going to talk about PPE in a moment. I've heard, and I'm sure in your your travels you've heard, and many folks listening to this episode have heard some say that testing and vaccinations are going to lead to a return to something approaching what we call normalcy. Correct me if I'm wrong. I think I saw that in the neighborhood of 350 million COVID tests have been performed in the United States alone. What is your broad opinion on the testing and vaccination programs, and how is virus evolution possibly going to impact what's ahead?
Yeah, great question, and also a question that we could talk for a long time about that. So, by counts on the information and the data that I'm looking, I think you're in the realm of that. I think it's between 350 and actually 400 million tests in the United States total. So, I mean, that includes rapid, molecular-based, serological testing. It's a big list that goes on with this. And that's on top, Bill. That is on top of every other medical laboratory test that people need run for heart attacks and sickle cell and bacterial infections. So important for the audience to realize that those tests were dumped on top of, my alumni and my colleagues of an already really heavy workload. So what's going on with that is that when you think about the virus is changing a little bit, like we mentioned. So in the United States right now, we have roughly five different virus variants. We have the B117, which is the United Kingdom version. We have the 1351, which is the South African origin. We have P12, which is Brazilian, a little bit of Japan. And then we have a couple of them, interestingly enough, out of California. And all of those, we believe, have changed enough to where they might be transmitting a little more effectively in the population. You're starting seeing that up in Michigan and Northeast right now, where you're hearing the stories about, they're kind of cooking again in those areas. So we're really keeping an eye on that with respect to will the vaccines that were created, as 6-8 months ago, looking at genetic sequences that were kind of from the start. Okay, so not to get too deep into this, but if that virus changes too much going forward, then the vaccines might need to be altered. And right now, they're still showing coverage of those variants in the United States. We have seen a few breakthrough infections, but it's only been in the really immunocompromised and the elderly. So they were probably already having issues with having a good vaccine response. Sometimes that happens when you're elderly and your immune system's not primed very well. You just may not produce a good response to that. So we haven't seen it, for instance, in people that are younger or healthier, or even in a proportion of the population that's concerning yet. But we're watching it, right? So we want to make sure that doesn't become a problem. And with respect to testing, if you can imagine testing just in kind of a simplistic view, whether it's a rapid test that looks at the surface of the virus, it's called an antigen, a surface antigen, or a test like PCR that looks at the genetic sequence of the virus. If that virus changes in either area and those tests start not recognizing targets to amplify or to light up on a test, they may start showing false negatives, or they may just not work as effectively. And so we start dealing with things that we talk about in the laboratory world of sensitivity and specificity of the test. So they're just not working as well. And you certainly can realize the implications of that. If you're using tests that aren't working well and you're getting a lot of false negatives, then you're not going to be able to do things like contact trace and really geographically watch where the virus is kind of cooking or spreading across a region. So very important implications that many people in the country and around the world are watching right now.
I do, a little bit later in our conversation, I do want to talk about staffing, because obviously people will be involved in resolving, hopefully ultimately resolving this issue. I want to encourage everybody to raise your hand if prior to 2020 you fully understood all involved in the PPE industry. Having worked in healthcare once upon a time, I had an idea, but Dr. Rohde, we've seen astounding growth in the PPE industry as the battle against COVID continues. A little bit earlier in the episode, Rick mentioned production and distribution of masks, sanitizer, gowns, gloves. The list is endless. We've talked about vaccinations. We've talked about testing and how they can help in this fight. What are your thoughts on the value of PPE? And on a more specific level, we've all heard the debate about masks, wearing masks. We've all heard the debate about using hand sanitizer. Where do you stand? Yes or no? Do you think they're going to remain important tools in the days ahead, or can we put them away in 6 months?
Yeah, lots to unpack there, right? So,
right
again, for the audience, personal protective equipment is kind of a large umbrella term for anything like a mask, a lab coat, gloves. If you're working in a level 4 lab where you're handling, something that might actually kill you, like Ebola or Lassa virus, you're probably going to have a respirator on that gives you a supply of air, glasses. I mean, all of that falls under that. And, we believe in it. As a medical laboratory and former public health laboratory worker working with rabies and hantavirus and other viruses, I mean, this was not just a suggestion, it was an absolute rule, or you didn't work in these labs. And so that's the way healthcare became quickly, as you know, and what you just mentioned. The shortages, what a crazy time. I think that was, and it still is obviously linked to raw materials and production lines, and certainly shutting down parts of the world during that month or two in last March and April really was something that I think those of us in public health and even in healthcare and elsewhere sort of predicted these sorts of issues, even a decade ago with respect to what happens when you shut the economy down during a pandemic. And so I'm going to keep tying this to the voice of public health funding and global recognition of how important it is to think about these issues now. We certainly have learned some hard lessons about perhaps finding ways to stockpile, finding ways to cooperate across the globe with producers of raw materials, and not just PPE. I mean, for us in the medical laboratory, this was raw materials for extracting RNA from the virus to use kits to actually do the testing. I mean, we literally couldn't do testing in some months last year because of shortages of equipment. We couldn't get it out of Europe and things like that. So this crossed all spectrums of the supply chain in that industry. I am an absolute believer in PPE. I'm a believer in masks with respect to what's been going on the past year. Moving forward, I think the United States and others will be able to look at this issue almost on a monthly basis now. And what I tell my friends and colleagues when they ask me this question is that right now, today, I still believe that masks are important. Certainly if you're vaccinated. And so, for example, I was very fortunate. My wife and I were able to be vaccinated because of our occupations. My parents and her parents are vaccinated. We're all past the 2-week window. So we had gotten together in the last week, actually, is when we first were able to do that and have a meal together at home. But we're not going out and sitting in a restaurant without our mask around, 50 people. So you can still do things safely and in context with what's going on in your community. But I don't think we're there yet, Bill. I don't think we're there to where the entire country can just go back to what they were doing, 14 months ago. I think we need to be careful in the coming weeks. And what I've been telling people is I hope by June 1st, by this summer sometime, that we can start looking at possibly doing things a little differently. And this is very complex, as you know. So with respect to, sports or anything else, when can we pack a stadium? When can we pack an arena? I think there's going to be a time where we can look at percentages of raising that. Perhaps we can just put one seat between two people, 3 feet. And if you have a mask, maybe you can do that. Or if you have vaccine status, maybe you can have areas where you can segregate. This gets into so many personal rights issues and other things that it's difficult to talk about. But it's something we need to, think about in a public health scenario, because without funding and without the support for these supply lines, including personnel shortages and stuff, we're going to relive this nightmare sometime in the future. So hopefully we're learning some hard lessons right now.
A moment ago, when you and I were first discussing PPE, you mentioned the need for raw materials. And so You look within the lab itself, clearly lab supplies are also important, without question. I understand that you're not involved with each and every clinical lab around the world, but in a general sense, and maybe specific to the U.S., how prepared are the labs in terms of having the equipment they need, the materials they need? What is the state of the readiness of the labs?
It's kind of a complex answer because certain laboratories, again, I'm going to speak from my personal experience here in Texas right now. Some systems, and I won't name them, some healthcare systems have really done a good job of kind of preparing. And by that, I mean they've actually went out and picked up different platforms. So they picked up three different industrial types of laboratory testing equipment in case one fails. They can move to the other. So typically in a hospital lab, you have a backup unit. That's always kind of the plan. And so that's important. It's something that's smart to do, but that's not always a fair and equitable process across rural communities, across smaller hospitals that are struggling. And so it's kind of a complex answer, but in general, I think most hospitals are prepared for COVID situations right now. The challenge is always, can you adapt that equipment quickly to, say an outbreak of influenza that we're not prepared for in the next 2 or 3 years. So there's just a difficult question around that with respect to equipment. But usually the equipment's not the biggest issue. It's the raw material, the testing kits, there's prep materials to kind of prep the materials before you actually test them. So, for example, when you get a viral specimen into test, you have to extract the viral RNA from that. That's an entirely different kit, and it may come from Switzerland because a lot of these kits are made all over the world. And so, again, finding ways to cooperate globally so that you might have sharing of manufacturing, not just sharing of things, but actually, can we switch and manufacture stuff here in the U.S. if something happens to the supply chain? Those are the kinds of solutions that I hope, we look at across the political and the industrial spectrum.
And we've seen that here. And Rick, again, earlier in the episode, touched upon it. We've seen a number of businesses across the country, around the globe. We've seen businesses change their manufacturing, now producing PPE. We've seen a number of businesses pivot entirely from producing X material to a year ago, 9 months ago, started producing PPE exclusively. So we've talked about materials. We've talked about the readiness of the labs. We need to talk about people as well. Public sector entities, and this has gone on forever, government agencies across the country outsource for many roles. Of course, that includes within healthcare. For years, Dr. Rohde, and I can't remember if it was the first episode you visited with us back in 2016 or if it was a subsequent visit, but you warned our audience about staffing issues in labs across this country. What's the latest on that?
Not much better, Bill, unfortunately. I mean, this is, I get pretty passionate about this, whether it's the medical laboratory or public health. And it's not just laboratory. This is epidemiologists, nursing, physicians, other areas. And I think what you see happening, certainly the pandemic, really, put a light on an ugly issue, which is staffing issues in these areas, but how dangerous it is. And I keep talking about this in terms of the pipeline. So what scares me is that many of my mentors that trained me and helped me when I was in my 20s and 30s and even early 40s are retired. And, some of those came out of retirement to help this past year. But what's scary is there's kind of this vacuum in the middle area of the age group. So we tend to pour out a lot of new graduates, and they may work 3, 4, or 5 years, and then they decide the salaries aren't what they want, or they're overwhelmed like this past year, and they basically just quit. They're done. They're tired of being overworked and just killing themselves. So they switch gears into something else. And so you leave this vacuum of a pipeline where you have a lot of new people that are not as experienced, and very few seasoned veterans. And that is a recipe for disaster, even when it's not a pandemic. So that really concerns me. We still have major issues. If I specifically talk to the medical lab issue, we have issues in the 40 to 50% vacancy issues around the country, worse in some places than others. And right now, I keep calling it a free agency issue, just to tie it to sports again. We have people that are paying nurses, for instance, 4 or 5 times their hourly wage. So why wouldn't you leave Texas to go somewhere else? And they're doing it with the laboratories too. Our guys usually make $25, $26 an hour. They can make 75 or so as a free agent, as a traveler. And so they'll pick up shop and head to, Michigan because they're in an outbreak or what have you. And that's good for them perhaps, but it's really rough on a healthcare system, say in Austin, that's losing multiple people with 6, 7, 8 years of experience behind their belts and stuck with brand new graduates or something like that. So there's a lot there. There's a lot of complexity, but it is something we absolutely need to look at and address. I am excited that the national government's looking at pouring, quite a bit of money into public health, including personnel training. We need new programs, new academic programs. We need scholarships. We need ways to make this doable for people. We need to look at salaries. All of that's part of the equation. And it's not easy. It's absolutely not easy. And I don't have an answer for every issue, but we can't keep doing what we're doing.
A final thing, Dr. Rohde, and I see we're kind of up against the time, but I refuse to conclude this episode without talking about something that you've championed for a long time, and that is medical laboratory professionals save lives every day. It's an important and very true message today more than ever, as you established a moment ago. Clinical Lab Week begins next week. Why are you so passionate about medical lab professionals save lives?
Yeah, thank you, Bill, for that opportunity. Indeed, next week, April 18th through the 24th of April is Medical Laboratory Professionals Week. And it's something we try to celebrate each and every year. Certainly, it's even more special this year. Last week was Public Health Week. And so those two areas are just really special to me. I've worked in both. I continue to work in both. And I'm just proud of our alumni here from Texas State, as well as many colleagues across the country that continue to show up every day, kind of behind the scenes. Typically, you don't know who we are because you don't see us like you might a physician or a pharmacist or a nurse. And everybody's important to that healthcare team, but you certainly want the people doing your medical laboratory testing to be competent, to be involved, and to be excited to do their work. They provide roughly 70% of all the data that physicians use for your healthcare. So without us, it's like having no mechanics at the airport, no certified mechanics. You need people behind the scenes that's going to get that plane into the air and make sure you're safe. And you need us to make sure you're going to get quality healthcare when you're at the hospital. So thank you for allowing me to thank everyone out there that's doing a great job.
Yeah, no doubt about it. It's certainly a team effort. And my wife, as you know, is an ICU nurse here in the Austin area. And so I kind of get a front row seat to what that team effort is all about, and having worked in healthcare once upon a time as well. Well, Dr. Rohde, on behalf of our entire audience, everybody here at the show, much respect and appreciation to you, and have a great week next week.
Thanks so much, Bill. And I'm looking forward to next week and beyond. We'll talk again soon.
I'll say it again. Thanks to Dr. Rohde, Dr. Rodney Rohde down at Texas State. If you're not following him on Twitter, you need to do so, quite frankly. Just a tremendous resource, a plethora of information from Dr. Rohde that, quite frankly, is applicable to each and every one of us. One of the reasons, obviously, that we had Dr. Rohde guest on the show again. He always does a tremendous job of presenting important information, but he does so in an interesting way. I think you'll agree. Well, now it's time to turn it over to our very own Rick Jennings, big smile on his face. Rick, what do you have for episode 1's crazy bids that you can win?
Thanks, Bill. I am very excited to get into this one for Season 1. We're going to start off this season with an awesome crazy bid. And this one comes all the way from Alaska's Department of Fish and Game. And the title of the bid is Vessel Charter, St. Matthew Island Blue Crab Survey. Basically, what the Department of Fish and Game is looking for is a USCG, U.S. Coast Guard licensed captain, and a minimum of 4 additional vessel crew to be able to basically run a research vessel for this department over in the Bering Sea's St. Matthew Island, just off the coast of Alaska. And they're planning on doing this for maximum of like 21 days or so. So basically, all these department heads and researchers are going to be just hanging out with the boat crew, while I suppose the boat crew, just kind of hangs out, watches research go on, mostly, just kind of sitting around watching everything happen for a pretty decent number of days, probably instead of having to brave these crazy waters of like what they would normally maybe be catching crab and fish in. And the classic programming from Discovery Channel I had mentioned earlier was one of my favorites, Deadliest Catch. I used to watch that for hours on end, just romanticizing being on a ship and everything. I'm sure it's awful during many circumstances, but I imagine if somebody's looking to actually put their vessel up just for like a research charter, this seems like just a real nice laid-back contract to go help some scientific and marine biologists like doing some research and whatnot. It just seems like such an awesome job, and I really wish that I had my own ship and I was a Coast Guard licensed captain so that I could do this. But either way, if you have these credentials and such, and you want to take me along with you just for the ride for up to 21 days or so, then that is this episode's crazy bid that you can win.
Rick, don't mean to apply any pressure to you, but you started off season 7 with a really interesting, fun, crazy bids, and that's what Crazy Bids is all about. Well, that's going to do it for episode 1 of season 7. So many thanks to our friend from Texas State University, Dr. Rodney Rohde. We appreciate you tuning in, sharing, downloading, and following our show, The Big Bid Theory, and please do us a favor. Spread the word throughout the rest of 2021. We are going to come by every once in a while with an interesting guest talking about an important topic. I enjoyed the emails I received during the break. If you are so inclined, you can shoot me over an email at bcolhane@bidprime.com. You can also follow us on Twitter. I mentioned follow Dr. Rodney Rohde on Twitter, but you can also follow us on Twitter at The Big Bid Theory. My personal Twitter is contract_hunter. So contract that _ hunter. We're also on Facebook. The show, The Big Bid Theory, is on FBook as well. Powered by Bid Prime, that is indeed a wrap on episode 1 of season 7. Again, Dr. Rohde, tip of the cap. Rick, tremendous job as always, and to the rest of the show's team as well. Put together a really good launch to our 2021 season. You heard from Dr. Rohde. Everybody still be careful out there. Find out as much information as you can from reputable sources like Dr. Rohde. That's going to do it. This is Bill Culhane. Until next time, go Gunners, Barracudas, Tigers, Bobcats, and Cubs, and we wish you all the best in growing your business.
Powered by Bid Prime, we thank you for tuning in to The Big Bid Theory. From Austin, Texas, the show is produced by Bill Culhane and Jim Ward. Producer and engineer is Rick Jennings. You can find other episodes of the show on platforms such as iHeart, iTunes, Spreaker, Google Play, Stitcher, among others. As always, thank you for downloading and sharing the podcast.
We're having so much fun.